Hi, I'm Justin Riley. Today on Wisconsin Doctors, sleep. Most of us in our country don't get enough of it, and the sleep we do get tends to not be very good quality. Well, for some of us, there might be a much more serious underlying issue that could be life-threatening. We're here at the Sleep Center here at Upland Hills Health in Dodgeville to find out a little bit more. And our guests will include Dr. William Donovan, who is the medical director for the Sleep Center at Upland Hills Health, Betsy Saar, a physician assistant at the Sleep Center, Sadie Olson, registered polysomnographic technologist, and Carol Kilkelly, a respiratory therapist. She'll talk to us a little bit about some of the equipment that's available to help folks with sleep apnea. That's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We are on location at Upland Hills Health in Dodgeville, and today we're talking about sleep studies and sleep disorders. They've got a great sleep center here, and I'm joined now by Dr. William Donovan. Thank you for joining us today.
Thank you for having me.
Yeah, and thanks for having us here. So tell us a little bit about Upland Hills Health Sleep Disorder Center, and what exactly does a sleep center do?
Well, we have been diagnosing sleep problems since the early 90s, and we have been accredited by the American Academy of Sleep Medicine since 2010, and we're recently reaccredited. There are 80 different sleep disorders, but primarily in a sleep center, we're focusing on several conditions. One is sleep apnea, and of which there are several varieties. And then we're also looking for leg movements and other interruptions of sleep during the night. Finally, these studies are done at night. We also do studies during the day, primarily looking at people who are excessively tired during the day without disruption of their sleep, such as narcolepsy or idiopathic hypersomnia.
And there's 80 different sleep disorders. That's insane to me that I never figured that there'd be that many. That's a lot.
But most of them, mostly what we see are the ones that I've already alluded to.
Sure. Interesting. Very cool.
So I think people probably want to know of all the problems we see, what would you think are the most common?
Well, I think we've already touched on that a little bit. Sleep apnea, which, as I mentioned, there are several kinds. The most common is obstructive sleep apnea, which basically involves when a person gets into deeper sleep, the muscles at the back of the throat relax and the airway narrows, with the first development being snoring, and then the interruption of airflow, which we refer to as a hypopnea, and then finally complete cessation, which is an apnea. But the patient is making an effort to breathe. There is another kind of apnea seen primarily in heart failure or neurologic conditions, sometimes in situations where people are taking narcotic medications, where periodically the person may just absolutely stop breathing.
And that's something that's pretty scary. And I just want to jump in and ask, what are the risks if this isn't treated properly, if sleep apnea is not treated properly?
Well, conventional sleep apnea, which I am basically referring to the obstructive sleep apnea, is associated with primarily two so-called comorbidities or medical conditions that are made worse if not treated. High blood pressure and depression, those are more or less short-term developments. Long-term, there are significant consequences, including memory loss, strokes, heart failure, and
lots of different pretty serious things, it sounds like.
Right. Actually, 2 studies that have revealed a higher incidence of cancer, believe it or not, in untreated sleep apnea.
Wow, that's incredible. We just have a couple seconds left, but Carol, I know you wanted to ask a little bit about treatment.
I wonder if you could tell our viewers the best treatment for sleep apnea.
Well, the best treatment has conventionally been CPAP, which stands for continuous positive airway pressure. And this is basically compressed air generated by a machine. It's sent down a tube to a mask. The mask is of different varieties, but has to fit reasonably tight on the face. And the compressed air is forced in the back of the throat. And the tissues that I was referring to earlier in terms of collapsing in deep sleep are stented or held open by the compressed air, allowing the patient to stay in deep sleep and not have these interruptions that cause sleepiness during the next day, and in some cases dropping of oxygen to levels that provoke these medical consequences.
So this is a very treatable thing, which I think is good to know, and it's very treatable here at Upland Hills. Dr. Donovan, I want to thank you so much for the information today. We've got to take a short break, and then we're going to come back and we're going to talk about sleep disorder symptoms. It's all right back. We'll be right back in just a moment here on Wisconsin Doctors. And welcome back to Wisconsin Doctors. We're here on location to Upland Hills Health, and we've been talking about sleep disorders, and right now we're talking about sleep disorder symptoms. So if you suspect that you might have a sleep disorder, this is what you'll want to tune into, folks. And I'm joined now by Betsy Saar, who is a physician assistant here in the Sleep Center. Welcome, Betsy.
Thank you.
So you're a physician assistant. Talk to us a little bit about what you do, like what your role is in working with patients.
Well, I'll preface that by saying, sleep disorders, there's a big interest in them right now, and we're getting very many more referrals. We have much more effective screening for sleep disorders. So with the volume of patients coming in and getting sleep tests, we have a lot of people who need follow-up. So I think my primary role is working with patients after they've seen the physician for initial evaluation and gone through a sleep study if needed, and then given their prescription for treatment. I think the biggest percentage of patients I see are people who are put on CPAP or some similar treatment for sleep apnea, and that's the biggest number. So the follow-up's very important. We have to look at a number of different things. First of all, is the patient able to tolerate the treatment? And that's a big part of our issues. So. And secondly, are they getting the result they need? And thirdly, are we effectively treating their sleep apnea? So we have a lot of tools for that, and when they come back for their follow-up, we go through those questions and steps very carefully. One thing that's really helpful at this stage of the game is the fact that many of the CPAP machines give us lots of information. Even in the time that I've been in sleep medicine, that's improved greatly. So when a patient comes in, we can tell if they have major problems in therapy and how well we're treating them. So I try to go through that with people each time, review any problems they have, make any adjustments in their treatment pressures, and if they have any medications for another reason, we review those too.
And you get a lot of that data just from the CPAP machine itself then.
Yeah,
that's very cool.
A lot of the objective data, and of course the subjective data, how the patient's responding is is equally important.
Right. Yeah.
So can you explain what symptoms would a person experience that might indicate that they should see a sleep specialist and or have a sleep study?
Okay,
From the
well,
get-go.
yeah, there's a number of sort of cardinal symptoms of sleep apnea in particular, and that would be people who typically they'll spend a whole night in bed trying to sleep, and then they wake up and they're completely exhausted or not getting a good refreshing night's sleep. People who have difficulty staying awake during the day. Trouble driving is a big red flag, and that's something we have to be very careful about. Otherwise, things like difficulty falling asleep or insomnia. If a partner reports loud disruptive snoring, that can be a symptom as well. There's other things including leg movement that sometimes people with restless legs and difficulty sleeping need an evaluation.
Yeah, absolutely.
So, Betsy, when somebody's having this sleep study, I'm often asked, how am I possibly going to sleep with all this equipment on me? How do you respond to that?
That's a good question. That's really important to make clear to the patient. So what I tell them, and I think most of us tell them, is be sure to bring anything that's going to make you more comfortable. So if they have a pillow or something that they think will just make them feel more at home. We want them to have a typical routine of their day, a relaxing routine to their day the day before. We do talk over with the patient carefully whether or not they think they might need a sleeping pill if they're in the lab and they're unable to fall asleep. And we will prescribe that. The protocol that we have usually is try to have the person get to sleep on their own. We usually give them an hour or so, but if they're really struggling and have difficulty, we will have a sleeping pill available for them to help them get to sleep.
Very cool. Betsy Saar, we got to take a quick break here, but Betsy Saar, thank you so much for the information today. It was great talking with you. Don't go away. There is more coming up right on Wisconsin Doctors right here. Stick around. And welcome back to Wisconsin Doctors. We're here at the Sleep Center here at Upland Hills Health, and we're talking about sleep disorders and symptoms of sleep disorders. And I'm joined now by Sadie Olson. I'm going to give my try on this. Registered polysomnographic technologist. How'd I do?
Did good.
Awesome. Great. Welcome. Thanks for having us.
Thank you.
So, if I feel like I need a sleep study, how do I go about, what's the process for getting one scheduled?
Typically, our patients are encouraged to speak to their primary care provider. Locally, we train them to recognize signs and symptoms of possible sleep disorders. They then do a face-to-face consult, and they will refer them to the sleep center. And then our medical director, Dr. Donovan, will review all of that and determine if they can go ahead with a normal sleep study or if they should probably see the sleep specialist first, depending on what their signs and symptoms are and what we might be looking at. I then will contact the person and let them know what the next process is, usually scheduling the sleep study or scheduling a consult.
So it sounds like you're kind of like the coordinator. You're kind of coordinating some of these efforts then.
Yes.
Okay, very cool. So they should talk to Sadie. Come on down and talk to
Yep.
Sadie.
Sadie, what exactly is involved with a sleep study? And I often get the question from a patient, are you going to be watching me all night long while I'm sleeping?
Yeah.
With a bucket of popcorn. Just
Yeah,
thinking
yeah.
Next.
Yeah, what a sleep study involves is you would come in, check in at admissions, we walk and greet you, you'll come in and get dressed for bed, and we hook you up to a bunch of wires, and we explain the whole process as we go along. Yes, we are watching you sleeping all night, but we're also really busy scoring the sleep study through the night, and if needed, treating you for the sleep apnea. You are hooked up to a bunch of wires. We do some quick testing and then hopefully get lights out and try to get you going to sleep.
Are any of the sensors put on with needles?
No, we have a needle to put gel in the head leads. It's like doing an EEG. We're watching EEG activity. So
But that
there's
doesn't
no
pierce your
needles
skin.
piercing skin or
Yeah.
anything. It's very harmless and
Yeah.
pain-free.
Yeah, that's good. Pain-free. We like pain-free.
Yeah.
So Sadie, with all the wires that you're hooking up, what exactly are you monitoring? What are you looking at?
We're looking at a bunch of things. I typically tell people, picture a lie detector test. That's what a polysomnogram is, except it's glorified with a lot more things we're watching. Biggies, we're watching the brain waves. We need to see if you're awake or asleep. We are watching muscles on the legs to see if you're kicking in your sleep. We're watching the heart to see the rate and the rhythm, because if there's something going on with the heart, we can notify the doctor right away. But the biggie we're watching for too is the breathing, the pattern of breathing and the effort of breathing, along with the oxygen level. So if there's a breathing event or anything going on, we detect that. And snoring, we can see if you're snoring. We can hear if you're snoring and see if you're snoring. And we are recording you all night to see what position you're in. So we're monitoring all of that.
So, I mean, it really sounds like you're gathering a lot of data during that time that's going to help inform, whether or not, especially with sleep apnea and the ceasage of breathing and so forth. It's kind of that's what you're looking for.
Yes.
A big part of what you're looking for.
And at the end of the day, it kicks out a report to say how much you slept, how many
Sure.
breathing events you had, how many leg kicks you had, how many snorts you had.
Wow.
Yeah.
Monitor all of that. It's
Yep.
great.
Well, what happens if you discover someone's not breathing correctly?
If they have enough times that night where they quit breathing, halfway through the night, if we have enough time, we will come in and put CPAP on, the breathing machine. What we do then is called the titration portion of the study, where we start you out with CPAP at a low pressure, with whatever mask we talked about or chose at the beginning of the night. The titration portion, we start you out at a low pressure. As you fall asleep, if you show any signs of obstructing in your airway, even snoring, we'll bump that pressure up bit by bit until you're breathing beautifully, sleeping beautifully. That's the goal.
Yeah, lots of good things happening here in the Sleep Center
Yeah.
here at Upland Hills Health. Well, Sadie Olson, thank you so much for joining us today, and thanks for the info.
Thank you.
Don't go away. There's more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville. We've been at the Sleep Center and we've been talking about sleep studies and sleep disorders. Up until now, we've been talking about what the process is for getting a sleep study or requesting or scheduling a sleep study and what's involved in a sleep study. Now we're going to find out a little bit about what happens if it's determined that you do have some sort of sleep disorder. And I'm joined now by Carol Kilkelly, who is a respiratory therapist here. Carol, welcome.
Thank you.
So you're going to be talking to us a little bit about the durable medical equipment available to patients with sleep apnea. How do you talk to us a little bit about how you fit into the sleep study team and what exactly do you do?
My role is to provide the equipment that patients will use to treat their sleep apnea. So generally, I'll get the order from Dr. Donovan, and I will call the patient, have them come into the office, or on occasion, if they can't get out of their home, I'll go to their house, and I will educate them on how to use it, how to clean it, what to do in the future if they have problems.
Excellent. So you make house calls.
Once in a while.
Great, great.
Can you explain to people how that equipment's covered by insurance?
Most insurance companies do cover the equipment so long as they've met all the criteria in the sleep lab and have a valid prescription from the doctor. Some insurance companies require what they call a prior authorization. So we have to submit the sleep study and all the notes that go along with it. They review it with their case management and give us either a thumbs up or thumbs down. Generally, they have pretty strict guidelines about what is covered and what is not. So once we determine if it's covered and what is covered, then we will call the patient and make them aware of their responsibility for copays and insurance coverage if it's necessary.
So you're able to kind of help the patients with the insurance end of things, at least kind of advising on what to expect in that.
Correct.
That's great. That's
Correct.
great news.
So once someone has it at home, what if they have trouble wearing the machine or the mask? They're having difficulties.
When we do the initial setup of the equipment, we give them exact instruction of what to do if it's going to happen or when it happens. Most people have a little difficulty in the beginning getting used to wearing mostly just the pressure or the mask. Nothing that usually is going to make them quit wearing it. Usually we can help them through any problem that they have.
So if they hate their mask, can they?
They can get a different mask.
Okay.
We'll work with them, and it doesn't matter how many they try. We'll go through the whole gamut and make sure that they are comfortable and they're sleeping all night long with their machine.
That's really cool. So it's literally not a one size fits all. Like, here's your machine, here's your mask, now go sleep. I mean,
Not at all.
You actually get fitted. I mean, is it something where you actually fit people, or you just have different options available that are already kind of available for people?
Both.
Oh,
There are
really?
a lot of
Okay.
different options, a lot of different manufacturers. Some people are claustrophobic and don't want a full face mask. Some only
Sure.
want something very small.
Sure.
So we go through with the patient whatever they feel comfortable with. Sadie, when she's in the sleep lab, usually will go through them and eliminate the masks that they know they're not going to like.
Sure.
So when she sends us the order, usually we have it narrowed down to what they're particularly going to like.
Because they'll have some experience with that potentially in the sleep center. Before
If
they
all
come
goes
to you.
well, yes.
Yeah.
Carol, once you have this equipment, it seems like there's a lot of different parts to it. Is it difficult to take care of at home?
It is not difficult to take care of. The only thing that we ask is that you have ongoing follow-up with the doctor, ongoing maintenance on your machine. So when we set the patient up with their initial equipment, we make sure that they know how to clean it, how to care for it, what to do if there's a problem, and we're only a phone call away, so we make sure that they feel comfortable knowing that they can call us anytime to get advice or help.
So if I am using a piece of equipment and I have future questions or problems or concerns, I can call you, and that's who I would call.
That's who we want you to call. We don't want
Okay.
you to call someone and get bad advice or
Sure.
we just want you to call and get the answer from us.
Sure, because you guys know the equipment better than anybody else.
Correct.
So, right, yeah. So tell me a little bit more about Upland Hills Home Medical Equipment. What other equipment do you provide? I mean, this is interesting to me because, this is something that's available via prescription if you have, an approval from your doctor. So talk to us real briefly about what kind of other equipment you have.
So durable medical equipment includes mostly sleep disorder equipment, home oxygen, hospital beds, respiratory equipment like nebulizers. We also do hospital beds, mobility aids, and bath aids.
Very cool, very cool. Well, Carol Kilkelly, thank you so much for joining us today. Thank you for the information.
Thank you.
I'd like to thank all of my guests today. We've been here at the Sleep Center at Upland Hills Health in Dodgeville. And from all of us here at CW57 and Wisconsin Doctors, we're inviting you to sleep longer, sleep better. We'll see you next time.